Speaker, my question is for the Minister of Health and Long-Term Care. Speaker, there are approximately 145,000 births in Ontario each year, and midwife plays an integral part in providing healthcare services to many of those giving birth. In fact, I know 4 out of every 10 women who seek services of midwife are unable to obtain it. We need to make sure those who would like to access services offered by midwives are able to do so. Through you, Speaker, to Minister, my constituents in South Scarborough Agincourt would like to know what is the government doing to increase access to midwife services.
Thank you. Minister of Health.
Well, thank you, Speaker, and thank you to the member from Scarborough Agincourt for this very important question, Speaker. Our government recognizes the enormous contribution that midwives make to our healthcare system and to the well-being of thousands of women and their newborn babies, Speaker. In fact, we've got 580 midwives practicing in Ontario, 78 midwifery practices. That's an increase, Speaker, of we've doubled the number of midwives that are practicing in this province. They're providing services to approximately 18,000 women a year. Speaker, I'm proud to say my daughter is one of those women. We're very proud of the work that midwives are doing. Speaker, the number of midwives practicing is expected to grow at about 15% per year. I want to assure them that our government is fully committed to supporting this growth in midwives.
Thank you.
Thank you.
Thank you. Supplementary.
Thank you, Speaker. We have faced some tough economic times. We have a responsibility to Ontarians to ensure that they have the health care services they need. It is important for my constituents in Scarborough Agincourt, indeed for all of Ontarians, to have timely access to care they need in the community, outside the hospital and in long-term care. Moreover, most importantly, every precious new dollars we put into a system must benefit the health of our patients. I understand alternative settings for giving birth, which would allow more routine procedures to be performed out of the hospital. Through you, Speaker, to the Minister, what is this government doing to make these specialized services available to women in Ontario?
Minister of Health.
Thank you, Speaker. Part of our action plan for healthcare in Ontario is about moving routine procedures out of hospitals where those procedures can be performed with highest quality and lower cost and better patient outcomes, Speaker, than in hospitals, or as good patient outcomes as in hospitals. And birthing, Speaker, is one of the leading causes of hospitalization for women in Ontario, even though there's no medical reason for the majority of women to have their babies in hospitals. And that's why we're moving forward with birthing centres. They'll provide a more appropriate form of care, less expensive than hospital, improves the birth experience, and reduces the exposure of new health risks for both mother and baby. So by transferring routine, low-risk births to birthing centres, Speaker, specialized obstetrical care and hospital capacity can be freed up for those women who need them.
Thank you. Wonderful. Question, the member from Newmarket, Aurora.